Okay, I'm happy to back in Sofia after 5 years. But I'm happy to see that now Bulgaria is very much developed, and then Sofia is very much a better city. And I first like to thank Medical Karachi for inviting me again. I saw lots of patients here back 5 years back, and now I see lots of patients. Actually, what we do is like we just give them advices over here, and then just try to help them about their decision making. And today also we saw almost like 30 patients, and then we actually talk to them and try to help them what they can do. For the eye, and then for the eye diseases, there might be lots of different problems. Let's say we saw lots of patients with cataract, and then patients who are seeking to be able to see near vision after cataract surgery. So we can provide them some special lenses, especially like smart or premium implants. That way they won't need to wear glasses after they're having surgery. So that was one of the things. The other thing I would like to say is I think glaucoma, which is eye pressure, which can be hard to treat. So if the drops are not working well, then we have to do some surgeries. That way we can stop it, because these patients are usually having this disease for a long time, and they're seeking really some medical help, and they're really bored of their diseases. So we can help them with some surgeries that would stop the disease, and they won't need way much, or many treatment after that. So that was one of the other thing. We also see very interesting cases like there were lots of patients, I think today, about keratoconus. Keratoconus can be a different disease that may need different types of treatment. So one of the patient needed a corneal transplant. The other one, we offered them a special contact lens. The other one, we offered them special laser with cross-linking. That's what we call cross-linking. It's like we stiffen the cornea. And the other one is we do a laser with cross-linking. And then that way they don't need to wear glasses after keratoconus. So each keratoconus patient needs special treatment. Also, there are some patients who they want to get rid of their glasses. One of the patients, that was a family, a mother and a daughter. The daughter was almost like 30 years old, and then we offered her a laser to get rid of the glasses. But for mother, who was almost 60 years old, and then we offered her a special implant. That way she get rid of the glasses for distance and near at the same time. So the treatment should be special for the age, for the needs, for what they're looking for. And also there were some patients about some retinal diseases. Especially these days we see epiretinal membranes are increasing. I saw a patient who was almost like 49 or 48 years old who had a membrane in his macula, and then he needs a vitrectomy surgery. That used to be a very hard surgery to be performed, but nowadays we can easily do it. And then we have a very, very small instruments that can go into an insulin needle, very small needles. That way the recovery period is very fast. So we also offered that one. So another patient was had a white eye, and then almost the eye was not seeing anything, but we can just paint it. We can just do a tattoo, like the ones that you do all over your body, and that way nobody would understand that he has like a white eye, and then and he can have a better social life outside. And I also, one thing I mentioned about the keratoconus, also the ring treatment was very, can be a very good option for some patients if they need it. I'm looking at my... Oh, there was a very interesting patient. He didn't have any iris, the color part of the eye. We can implant an iris, an artificial iris. That way he can have an eye that's a colored eye, and also he's not gonna... he doesn't need to refrain from sun. That was also another interesting patient. Also some retinal problems, and also we all had a patient, which is rare, but had a tumor in the eye, and we can offer some treatment for the tumor. And then if you're very successful, you can, save his life and save his eye. So we can do some treatment about those things too. So finally, it was very good to be over here and then see nice people, Bulgarian people, Bulgarian friends over here. I'd like to thank Svestelina, if I pronounce it correct, and also Jamal for inviting me here in the name of Medical Karachi. They had a very good arrangement and very nice coffee to support me. It was very nice for me to talking to people and trying to help them, just giving them some advices. And I hope to see them sometime in Istanbul. That way we can help them about their diseases. Thank you all. Благодаря.